All right, and good evening, everyone, and welcome back to the STEM Files. We are the voice of STEM talent and Black culture, where we highlight the best and brightest in science, technology, engineering, and mathematics in the Black and Brown community. Tonight's episode, we're going to be talking with Reana Muhammad. She's a senior proposal manager, and she's going to be talking about clinical trials by the people of God. We're going to be talking more about how clinical trials can run if they're operated by the people of God. So definitely stay tuned for more after this. All right, family. Once again, welcome back to the STEM Files. We are the voice of STEM talent and Black culture. My name is Tariq Muhammad, aka Tariq Cardiac. I'm a biomedical research scientist with a concentration in cardiovascular pathobiology, which is the study of how diseases form in the heart and blood vessels. I also work with patients in a clinical setting after they have had some type of cardiothoracic or cardiovascular procedure. I'm typically joined. I am joined. I'm sorry, bro. I am joined by my right hand man, best friend, business partner, all that. Jabril.
Yes, sir. Peace, love, and blessings, everyone. It's your brother and servant, Jabril Muhammad, aka Jabril Engineer. I'm a civilian mechanical engineer focusing on naval ship fluid systems with a background in material science and engineering, the study of the various material classes and how their various structures can lend themselves to different applications. I'm also the humble co-owner and director of engineering at Original Man Scientific, our parent company and science and technology company, striving to add invention and innovation to your community. I'm happy to be here. Let's get it, and let's get into some great questioning, some great content this evening.
Absolutely, absolutely. And as we mentioned earlier on in the show, family, we are the STEM Files. We do our best to highlight some of the amazing Black and Brown talent that we have in the community under the umbrella of STEM, which is science, technology, and engineering and mathematics. So tonight's guest is a senior proposal manager from Richmond, Virginia, right here at Muhammad's Mosque number 24. She works in clinical trials. She helps to write the proposals, manage the actual trials themselves, and so much more. So welcome, Sister Reana Muhammad, to the platform. Assalamu alaikum.
Hi, thank you. Walaikum. Thank you so much for having me.
Yes,
Absolutely.
ma'am.
Thank
Of
you for
course.
joining us. Excellent. So before we get into it, can you tell us more about yourself, where you're from, what got you involved into what you're doing now, and what are your plans in the future?
Okay, so I'm born and raised in Richmond, Virginia. I went to VCU for undergrad, where I studied biology and minored in psychology. Um, I knew I wanted to go into like a public health field. I just wasn't really sure how I was going to like do it. So I got into proposals, ironically, working with the FDA. But the proposals that I was doing with the FDA were more about regulation of tobacco.
Mm,
And so that's how I got into it. And that's when I was more like really, really interested in it. But, the difference is like when you don't partake in something, it's a very different world to be a part of it when it comes to like working on proposals and contracts and things like that. Because I just feel like cigarettes should be abolished in general. Like I really don't think it should actually be
right.
something that
Regulated.
we actually
Right, right,
regulated in
right.
general. I'm like, well, why do we
Right.
still have it? So I knew I wanted to stay in regulations, and then that's when I started to go back into my science roots and work in research. And so when I went back and worked in a research lab. I started writing contracts and proposals for them. And that's how I kind of got in the clinical trial space. And that's where I felt more comfortable because it was literally something where I felt like I enjoyed doing it, but I also felt like it wasn't a harm. Like tobacco to me is a huge harm. So
Right.
nothing productive, in my opinion, comes from that, you know. So yeah, so that's how I started with that. And yeah, I really enjoy it. Like there are different phases in clinical trials, and then there are different therapeutic areas. So being able to understand and have the knowledge and the research with that is really great. And it helps, you know, personally as well, because you just have an idea of how things go if you decide to even go that route when it comes to like clinical trials. As far as like a future for me, I feel like, you know, I'm pretty much someone who likes to, like, I'm a boss. So
That's
future,
right.
I mean, you know, I want to be the director. So that's
Okay.
what I want to do. So I would let, that's the future, is to be director of my department.
Excellent. Excellent. And you made a very good point about, you didn't feel comfortable working in regulation of things that are harming our people.
Right.
So can we talk more about what is motivating these companies? What's motivating the federal government to continue to regulate things that are scientifically harming our people? They have the evidence, they have the all the case studies, they have all the testimonies, they have all the commercials with people holding the little devices up to their neck or what have you. They have everything they need to completely abolish cigarettes. So, what is the motive? What keeps them motivated to keep pushing these products to the consumer and pushing regulation on these products?
It's literally 100% money. So it is, and when it's weird because I think that when you think about like human beings in life, you know, everyone has that sore spot in their heart where they're like, you know, this is a person. No.
Yeah.
When it comes to the government and it comes to everything, it's about money. Tobacco is a $1 billion business. And I mean, when I say billions, I mean billions. And it helps them keep America great, because if you think about it, America was built on tobacco. So to
Right.
get rid of it for them, it's like literally getting rid of like their history. Like they feel like,
Mm,
oh my goodness, like no, you're not. We already have to like segregate with Black people. Now you want to get rid of tobacco? No.
Talk.
And so it's literally like it's history and it's money, and it's a lot of money. And then if you think about it too, the push to try to act like we are not promoting to young people is based off of the lawsuits, but they are still promoting because we are in a generation where we're not really smoking. So if you think about it, when the older generation dies off, the money's gone if we're not smoking. Like if we know the harmful effects, if we know that we're not going to even put ourselves, you know, in those situations, and we're not going to even start doing something, they already see the decline in it, and it scares them because, like I said, it's such a $1 billion business. And so basically they will quote unquote follow the law by putting the warnings on there in hopes that it's so addictive, which it is. That's why people still smoke. I mean, the warnings are on there all the time and people know what they're getting into. I was able to meet so many people who were just like, we can't stop. I mean, it's super addictive. And I've been blessed to never have to have that feeling. So I couldn't imagine being on something that you feel like you can't even get off of, and the medicines or the patches and things that they have are not really necessarily working, especially for a lot of
right.
people.
Right. Right. Wow. The wait. I've always I've always said that we work in similar fields. So seeing when we still have to have regulatory agencies like the FDA, CDC, still trying to control what they openly know is harming us. It
Right.
kind of drives you, and it shows you, just being a follower of the Honorable Minister Louis Farrakhan, as taught by the Honorable Elijah Muhammad. You see everything in science. Science is one of the most, not so much validating careers of the teachings, but the most exposing career. in terms of what the enemy does to our people. You see it most in science. You see it the most there because you get to see how everything is controlled, how these agencies do things, and how they manipulate the communities to keep consuming these products. So I just want to bear witness to what you're going through. Jabril, did you have anything?
Absolutely. I'm glad we're going down this road, if you will, as it pertains to what we do in society that's not necessarily and not at all conducive to our health. And it speaks to the true priorities of this world and this world's leadership as it pertains to the ability to continue to create, generate, and increase a falling dollar. So for people who know me, if you don't know me, I'm a big YouTube reactor fan. So I love to watch YouTube videos where you have reactors react to current content across a number of different areas, if you will. One of the channels that I watch a lot, if you know, it's called Abba and Preach. So there's two guys who talk about a lot of things. And I was watching something, they were talking about a conversation about McDonald's. And one of the things, now they're Canadian. And one of the things that they were talking about is how not all McDonald's are created equal, even amongst the same franchise. So you go eat at McDonald's in the States, you go eat at McDonald's in Asia, go eat at McDonald's in Canada. It's like you at 3 different restaurants. Yeah. And why is that? Well, you talk about regulation, if we're going to get into that conversation. Certain things that the FDA approves as being edible and okay for you to eat in the States are completely banned, as well as certain practices on cleanliness or what have you, banned in Europe, Asia, or what have you, and in Canada. So you can go to a McDonald's here, and it's like, oh my God, it smells like food it's not even made here. But then you go, I've been to, not that I've eaten it, but I just walked into McDonald's. I was in Japan one time for work, and I was like, this cannot, like the chicken looked real. Like, I was like,
it probably tastes better too.
Right, they don't even sell the same food here. And I'm like, so now when we start the conversation about clinical trials and things of that nature, it's the level of business ethics from one place to the next, from one entity or business entity to the next, is very different as we kind of engage that conversation and go from place to place. So that's a beautiful point that was brought up. I wanted to kind of continue on. Oh, he's back. I was going to continue going on. I know you would want to get to that clinical trial, but I was just making a point, bro, about
good.
Just the concept of regulation and how going from place to place, and depending on who you're dealing with, regulations will lend you to being exposed to a different product depending on where you go. So that was my only point.
Okay. Awesome. No, I always have a technical difficulty, so you was good, bro. We got a greeting from the Black Math Academy. All right, so now we're going to go ahead and get into the clinical trials. This has been an illuminating show already. I love what we're talking about. So let's go ahead and talk about what a clinical trial is. So, Sister Reana, every time we have the STEM files, every time we go live, we always want to make sure that we clear up any type of terminology that we present to the audience, because we're about STEM, but everybody that comes on to watch our platform isn't necessarily in STEM themselves. So we always want to clear things up. So can you tell us, what is a clinical trial? What makes something a clinical trial? And how does it, what are the inner workings of a clinical trial? Let's start with that.
So basically, the inner workings of a clinical trial would be usually it could be a specific doctor or a group of doctors or a company that wants to bring a medication to market. But in order to do that, obviously you need some type of data. And the best data to get would be with humans. Obviously, some medications are tried on animals, but you would want a human, and you don't want to have to deal with PETA. So, so people don't want to just put it out there. Put it
PETA, they like the mafia. Like,
yes, they will destroy you.
They will.
Goodness.
Ruthless.
Yes. So but the medication has not been hasn't been FDA approved. So basically, before you start clinical trials, the organization or the doctor, whoever wants to do the clinical trial, has to submit work to start a clinical trial. So they would be submitting some work to the FDA that this is what they want to do. Based off of research that they have, they feel like these are the candidates that they want to look for. So I would say, if I could be specific, I would say, like, if you think about dermatology, because they have a lot of clinical trials in the dermatology space. It's usually going after specific things. So let's just say eczema, and they're looking at what's already on the market and what the issues are that patients are having with the things that are on the market, and how can they make it better. So once they get that information, they send it in to start clinical trials. The difficult part of a clinical trial is actually getting people in clinical trials. So they have companies that they source to even just find people that even want to be in the clinical trials, that be in the clinical trial. Before COVID, I would say it was extremely difficult, and it is still now extremely difficult, but because of COVID, we have opened our eyes to a lot of remote things. So the agile clinical trial space has really opened up, and it's a really big boomer right now, where basically you're able to participate in a clinical trial from anywhere in the world. So you don't necessarily need to be in a specific place, going to, having that specific doctor. So that makes it a lot easier, especially with infectious diseases. Those are the hardest. And again, trying to get a certain amount of people, because you need to have a certain amount of people in your clinical trial that completes it in order to have the proper data. And that's another thing that you look at, because people will start clinical trials and not finish them. And that's why sometimes it takes a really long time to bring certain medications to market, just because they need to get a certain amount of people in that clinical trial to fulfill FDA requirements. Now, after they have established that they want to launch the clinical trial, like I said, a lot of them hire companies to find people to be in the clinical trial, reaching out to them. If it's your own personal doctor, so I can say from personal experience, I've had my doctor ask me to be in a clinical trial that she was running. And people usually feel a lot safer and more comfortable when it's your doctor versus a random person on the internet being like, "You want to be in my clinical trial?" Don't do that. Don't do that.
Well, what you mean?
Yeah, exactly. And then from there, there's obviously the paperwork that you need to read through thoroughly. Basically, kind of giving up a lot. Basically, the paperwork allows them to get out of, if you die, you can't sue. That's the easiest way I could say it. The paperwork is really intense. And then once you do that, then obviously you're in the clinical trial, and some clinical trials pay. So that's the other motivating factor, especially for, I would say, less fortunate communities. That's a huge thing that people will try to get you into, because they will pay. And if you think about it, if you are, strapped financially, and you have someone saying, every time you come in, I'll pay you $80 to $100 cash. It's very, it's very appealing. And then yeah. And so basically, after they get enough people in the clinical trial, then they will start it. But you have to basically have a lab. And that's where the CROs come from and the different companies come from, because you need to be able to have labs run the lab work on the patients and everything like that, in order to have the documentation you need to give to the FDA if this actually works or goes through.
Got it. Okay, so hopefully our audience they should have a very good understanding of what a clinical trial is, what it's meant to do.
Right, basically.
and not what, right. Yeah, absolutely. And you mentioned something very key. You mentioned something about safety and people participating in something that they told it was going to be about, and not something that they experienced. So it brought me back to the Tuskegee syphilis experiment. And I would be remiss if I didn't bring that up, considering we're talking about clinical trials. So let me ask you this, just from what you know about clinical trials, right? What would be to you, as somebody who understands how they work, what would be the first, what would have been the first red flag from that experiment that you saw when they first came out with the study, when they first rolled out everything that they were going to do for that experiment?
I would say,
That's a great question.
I know it would be. I mean, also going off of the assumption that w- what they had them sign was not accurate. And
Mm,
obviously, now with lawsuits and things like that, they are a little bit, they're better with with putting things in writing. But if you don't understand it, then it just still doesn't make any sense. So
right,
so
right.
that's another
Even if
thing. So
it's
no, they'll
You're right,
tell
it may
you
be
about
plain
it,
as
but
day
it's
to them,
still,
right?
it could be plain as day. But I would definitely say it was probably them not knowing exactly what they were getting, because in clinical trials you will have a placebo, and a lot of times you don't know if you have the drug or the placebo. But with the Tuskegee, they were injecting them with syphilis in general. So goodness, that was just,
Mm.
I don't know. And I also feel like I also probably would have been. I'm very weary of white people in general sometimes. So
Hey,
I
It's
talk.
would
Be real.
understandable,
say,
man.
We got to keep it a
Understand.
buck.
Hey,
We
I
Hey,
got to
mean, you
keep it
have
Jasper,
a
to be
buck.
hold on, hold on.
100.
Before we do this, this is not for those who are watching. We are not in any way, shape, or form bashing another group of people to make a point across.
No, we're
We are
not.
talking about experiences from history. Just want to put that out there in case you two get all funny. But go
Yeah,
ahead.
that is true. That is so true. Experiences. So yes. Um, and also understand, like I think we also forget that in any um I would say any mutual business decision, someone has to gain something. Both parties have to gain something. So you have to be very conscious of that. So I feel like sometimes that's missed, that, it comes across like, oh, they're helping, by having us do this. So no, it's a benefit for them, and you have to understand what the benefit definitely is. But I would definitely say in the Tuskegee experiment, I definitely feel like it was probably more, they just didn't know what they were lied to completely.
So you're saying pretty much that the federal government just took advantage of the lack of knowledge that the people had about
Oh, of
syphilis
course.
itself and how things are supposed to be going. So they just took advantage of all that.
Yeah, of course. Yeah.
I mean, that's
Jay, I see you. Go
so.
ahead, bro.
I'm just thinking, like, because as you're talking, I'm doing my best to really absorb. I always strive to absorb so much when any guest comes, particularly when it's a guest that's outside of my wheelhouse, because I learn so much. You know, we talk about things, and my mind is going to the scriptures, and my people are destroyed for a lack of knowledge. And one of the things that we have to understand is to conduct business or to have a truly uh, um, to have a collaboration that is truly of mutual benefit, both parties have to have similar levels of education and understanding of the topic. I can't truly deal in business with somebody that I own intellectually.
Mm,
Right. Right.
I can't. Like I can't engage in a true deal with someone who doesn't understand the playing field that they're playing on. So one of the things that's important, I think, a lot of times in our community in particular, and for good reason, but still, we start to equate things as being bad because of how we are treated. So, for example, Black people are squirmish as heck about clinical trials and of themselves because of
right.
history.
By itself,
But
exactly.
clinical
Yeah.
trials in general are necessary to get certain, you know, groundbreaking treatments and things off the ground. You could talk about vaccines in the same way, right? The concept of a true vaccine makes sense, time and place. right? But you also have the concept of dirty vaccines. Keep it a buck. I could say the same thing about water, fruit, whatever. I'm supposed to ingest those types of things. But when we talk about Monsanto and we talk about these types of things and poisoning of our earth, see, anything can be done against you if it's not done with a pure heart and you're not doing it with the purest of intentions and the purest of resources. So that's a very big point for me. I'm glad that we brought this up. I also have to say, family, I want to thank all of our audience. Y'all went stupid in the comment sections on Instagram when we asked y'all
Yes.
to submit questions, and we're gonna do our best to get into all of those because we're not in the business of asking people for things and not utilizing what's
You're right.
provided. So
They'd be like, you didn't even ask my question.
we are definitely about to get to those questions because it was like, yep, I need this question. So I'm about to bring some of those up if you don't mind, bro.
No, go ahead. Absolutely, those questions could completely run the show. Like those, wait till you hear them, Sister Reana. They're incredible questions.
Right. So I'm gonna go. It's only right. I gotta start with my bro first.
All right, go ahead and do the when you read the question, say the @ handle too.
Okay. So this is not so much a question, but just kind of going into this topic. So this is at RDZ Lyles. That's at RDZ LYLES. This is like my brother. We went to college together. Finishing off his PhD in cancer biology at U Miami. So he said, talking about our topic, good topic. Please discuss the importance of diversifying geographies and social economic status when conducting later phase clinical trials.
But before you answer that, let's go ahead and break down the phases of a clinical trial, right? So,
absolutely.
There are many phases of it, and these phases are important because it allows the drug or whatever is being studied to go to the next level. So, can we talk about each phase and what they represent, and then go into that one?
Yeah. So, clinical trials usually go through about like four different phases. And usually it's based off of the outcome of each different phase. And you would be able to look at and see how many people have finished that phase, if the medication was working, if it wasn't working, if people dropped out, if you need to add new people, things like that. And I mean, a clinical trial from start to finish could take like years. To do, definitely. And like I said, each phase is definitely it's based off of the results that you have to move on to the next phase. And clinical trials can stop in different phases. It doesn't necessarily go through to all the phases. They can look at it and see that it's not working, or we don't have enough people, or what we thought was going to be the outcome is not, and things like that. And the other great thing about clinical trials too is you're able to find out sometimes that there are medications that they start with the idea of something, and it works for other things as well, or it's showing promise and working with other things as well. So one of the things I would say is I don't know if people know about like the medication Dupixent, but that's an injection that is used to control eczema and used to control asthma.
Right, so that's pretty much anti-inflammatory medication.
Anti-inflammatory, yeah. So they use it for both. And throughout the process, it was started with asthma, and it's shown to work with people in eczema and things like that. So that's
okay.
That one. And the question.
So I gotta wait for Jabril. He has the questions. I gotta wait for him to come back on. But I believe he was talking about diversifying geographical something in the later phases of the clinical trial. So when it's starting to wrap up or finish up, and they know. Oh, there you go. All right, bro. Can you repeat that question real quick?
Absolutely. I'm glad we broke that down first.
Bro.
No, you good. You good. Pardon me. I had to adjust something really quickly. But we're back on task. So this is from at RDZ Lyles, at RDZ LYLES. So he's talking about the topic. Good topic. Please discuss the importance of diversifying geographies and social economic status when conducting later phase clinical trials.
Oh yeah, no, it's so important. It's so important, and I think that a lot of companies have added their diversity and inclusion, which is super important in clinical trials because there are a lot of areas that weren't being tapped into. And there were a lot of people that didn't have access to certain things like that. And it is helpful because when a clinical trial has the diversity, you're able to give the proper warning signs as far as what you can expect, and especially being able to diversify age in certain things. A lot of clinical trials, it's really difficult when it comes to like children.
Mhm.
So that makes it makes it difficult. But if you're able to do clinical trials and have children in it, it's so helpful, because a lot of medicines that aren't tested on children they're not allowed in they're in the market, but they're not allowed for certain ages because they have
Gotcha.
not been able to do the research. So no, I think it's
Okay.
very, very important. And I think the one of the things that I can say that is super helpful because of COVID is the agile clinical trial space, which has been shown to grow extremely. And to be a part of a clinical trial like that, an agile clinical trial, all you would really need is the internet and a cell phone, and you can be a part of it, which is really great. And you can have direct access to your doctors. So I really feel like with the technology that we have, we'll definitely be able to diversify clinical trials a lot more.
Excellent, excellent. Thank you so much for that. And as a matter of fact, we're at that 30-minute mark, so we want to go ahead
Oh
and
my Lord.
right already. We're gonna go
That's
ahead and do
crazy.
a few plugs real quick. One of them being the Nation of Islam's flagship product, which is the Final Call newspaper. I'm gonna go ahead and play a video real quick, and then Jabril, we're gonna talk about this week's issue. Is that good?
Of course. Yes, sir.
All right, let's get it.
Now you can get the same uncompromising truth you've come to expect from the Final Call newspaper on all your connected devices. Subscribe to the Final Call Digital Edition today. Go to subscribe.finalcalldigital.com.
All right. So, what is this week's edition about, beloved?
Yes, sir. So, first and foremost, family, this is the Final Call newspaper. It is the flagship news source of the Nation of Islam, a message dedicated to the resurrection of the black man and woman in America and around the world, and really the whole of humanity. Make sure, if you have not yet, you want to go get your digital edition at finalcalldigital.com and follow at Final Call newspaper on all platforms. This current edition is titled Pure Evil, Accused White Terrorist Slaughter of Innocents in Heart of Black Community has reopened old wounds. It's a reminder of deep, deadly race hatred in the United States. Now, those can get to talking about, oh, this is race baiting, this and the third. Listen, I don't know what else you want to call it. Now my thing is, again, there's so much that circulates around on social media, but there was some commentary and memes floating around about this man's thought process and motivation for why he did it. And it basically stemmed from being
COVID.
in the house from COVID. Now, I don't know about you all, but the pandemic has done a lot in isolating people, but people have found so many more constructive things to do than go out and try to murder people. But you found it. Even though you were going through what you were going through, you still were able to differentiate one people versus another by apologizing to the white person you scared the crap out of to continue to go after
You can't
our
make this stuff up, man.
So we can't make this up. So family, please take the time to go through and read the Final Call for yourself. Do not take our word for it. If you're in the Philadelphia and Richmond areas and want your physical edition, please tap in with myself, Brother Sreek. You can DM us on social media. You can become part of our growing customer bases. The Final Call newspaper is a local, national, international news source. There's health and wellness pieces, spiritual pieces from the Honorable Elijah Muhammad, the Honorable Mrs. Farrakhan, Brother Student Minister Jabril, our late but always great Mother Tynetta, There's also
Yes, sir.
international pieces. There's pieces about art, different national products, books, tapes, etc. You don't want to miss out on being a part of this movement and staying in tune with what's going on around you. The Final Call newspaper family. Get your latest edition today.
All right. Thank you for that, beloved. I appreciate that.
Yes, sir.
Yeah, definitely go ahead and get your copy today. We also have a Black Business Highlight. Now, usually the Black Business Highlight is from another person. It's not from the actual person we're interviewing. So I'm excited about this particular Black Business Highlight because in addition to being a senior proposal manager for clinical trials, she is also a business owner. She also has two businesses, actually. So if you don't mind, Sister Reana, can you please go ahead and talk about your business, Quinn Parfums, and as well as your handbag company?
Yes. So Quinn Perfumes basically just came from the fact that me and my sister love candles. And outside of like science, being creative is something that I really enjoy doing. But the beauty of science was I felt like I was trying to figure out how to make a candle different, and I really thought about it, and I felt like this was like a space that no one had really tapped into as far as using like scientific beakers and things like that. And it just kind of aesthetically made it different. And that's
Yes.
me. Like I just like things that like are aesthetically different. And I also believe that there's, it's science in everything that you do. So
Right.
taking it and bringing it to the candle field was it was really fun, and we have great feedback, and a lot of people like love the candles, they love the diffusers, and the beakers and everything that they're in are reusable, which is really great for the environment. So wanting to also be eco-friendly and conscious of that.
Excellent. Thank you so much for that. We definitely plan to cop a few of these products for our lovely wives, and just for the fact that they are science-based is enough for me. So definitely gonna be getting some of that. Also, I would be remiss if I didn't shout out your parents, Sister Captain Linda Muhammad, as well as student minister, Brother Jerry Muhammad. Brother Jerry has been very influential in my growth and development as not only an FOI, but a student in the ministry. He's taught me so much. I remember when we first moved down here from New York, Brother Jerry was like one of the first brothers to really teach me about coming before the people of God and actually doing public speaking, anything of that nature. So I want to appreciate your parents. I want to appreciate them for bringing you into the world and everything that they've done in their respective journeys as soldiers. So thank you so much. And I know y'all watching, so I ain't trying to gas y'all up. I'm just saying I appreciate y'all.
No, I know they're watching. I know they are.
Excellent. All right, bro. So let's get back into it. So what are some other questions that we have from Instagram?
Absolutely. So we have another one. This is from another one of our dear supporters. This is at Farmer Courtney.
Yes.
So it says, what are the top 3 red flags to look for that would help us spot unsafe ones, meaning clinical trials, before participating in one? And then it says, and on the flip side, how to vet the validity of a clinical trial to determine if the trials were on the up and up.
So I think we answered the first part a little bit. So you want to go into the second one, or if you want to talk about just red flags in general from clinical trials outside of Tuskegee. So yeah.
Outside of that, first I want to say, I'm not a doctor, so the biggest thing I would always tell someone is one, vet the information. And so I would always say, like, if you have a doctor that you trust, obviously you should, I feel like you should always have a doctor you trust. If you're going to this person on a consistent basis for whatever issue you might be having, you have to feel like you can trust them. Obviously, we know that they won't always be forthcoming, but I would never go into a clinical trial if the information was not given to me from someone with credentials, first of all. So there are a lot of people out here and you can vet credentials, like go, feel free to make sure that a person is who they say that they are, just because we live in a crazy world. But I would never do anything that wasn't vetted in that way. And basically literally read through it. I know it's a lot, and I know a lot of people skip over things, but read through everything. And even if it takes time, don't let anyone rush you. Don't let the doctor say, "Oh, you need to be in this clinical trial by next month." If you haven't, done the vetting and you need to sit and think about it, do that. Read through the clinical trial, and ask about the ingredients. I think that's something that a lot of people don't necessarily think that they can ask about. Ask about what's in it. They're going to give you paperwork. Don't feel bad Googling something and making sure that it is what it says it is, because scientific terminology can be really tricky for a lot of people.
For sure.
Um,
Mm-hmm.
and then, and that other than that, I would just, like I said, I would definitely vet it to the point, by making sure that the ingredients is what it says it is, trusting your doctor.
Yep.
Yeah, it's kind of like that apple
The
turn.
Black Math Academy be on it. Listen, beloved,
It,
why you don't call me out? Please don't do that. Because the Apple term, you know how thick that Apple terms and conditions, but I feel you. You're absolutely right. You're not wrong.
right.
You're not. You're not. We all
It
need to be
is.
doing that. And they're counting on us not reading it.
Yeah.
They are. They really, really
Yeah.
are. And another thing I would really say, and I know some people don't always like and every condition is different. Um, if you read How to Eat to Live and you
Come
try
on.
to strive to be on that path, a lot of the illnesses that you feel like you have, a lot of the pain or the irritation sometimes is in just the way that we're eating. And a lot of doctors won't tell you that. So I would also, take a step back because not everything has to be controlled through medication. I know that that's what they tell us, but it doesn't.
Mm-hmm. Come on.
So you really have to, how to eat to live and make sure that this is something that is a necessity. It's like necessary because not
Right.
everything is necessary.
Right.
I had a whole battle with eczema, and there's a lot of different things out here that you can do without having to be in a clinical trial.
Right.
Um, and it had to do with just changing environments and diet.
Mm.
For
But
sure.
like I said, always read the fine print thoroughly. And I mean, even go as far as having a lawyer look at it to make sure that you're not signing away something that years down the line you can't come back to,
That's right. That's right.
you
And
know?
I just want to
And
bear witness to that. That me and eczema was boxing when I was a teenager,
oh
and
yeah.
that
Oh
that
yeah.
that stuff used to go in, and just being able to understand that the nutrition and the environment, your stress levels, everything plays a part. The soap you're using, all of that
Hmm.
stuff. Just do process of elimination. Take certain things out of your life and out of your day-to-day routine, and just see how things change. I just wanted to bear witness to that. But go ahead, sis.
Yeah, no, you're right. It definitely is. So I just wouldn't say clinical trial should be the first thing, but if you've done all that, um, and you've vetted it to the best of, your knowledge and your ability, there's no like website I can send you to that's going to be like, no, this one is better than this one. The FDA
Yes,
doesn't
ma'am.
work that way.
Got it. Got it. Thank you so much for that. And very key, people. Medication isn't always necessary. So I want that to be the takeaway message from tonight's show. Medication isn't always necessary. It shouldn't always be the go-to. But go ahead, bro. I see your wheels turning.
As you're saying that, I would like to offer additional depth to that. I think what this world purports to be medication is not always necessary. So, for example,
Mhm.
food is medicine. So,
Yeah.
medicine is always necessary.
Yeah.
But
We
what
talk
do
about
we
the
consider?
okay, go
What do we
ahead.
consider to be medication,
Right.
and what do we put our faith in as that which is going to make us better? See, what we
Right.
have to understand is, in addition to what Sis has been talking about, we have to check a couple of things. Check the source and what is our motivation for engaging a clinical trial. A lot
Mm.
of times, what Sis was talking about is, will they pay? Well, if this clinical trial was free, would you take part in it? If the answer is no, then you have to really consider
Right.
do you really believe in the vision that is being cast through said clinical trial? Again, clinical trials in of themselves are necessary, right? But then follow the money. Okay, so we talked about a lot with this pandemic and everything. Like, people are good for telling you that you need something without knowing you. You need this, you need that. Well, hold on. One of the things I always thought was funny when people would talk to me about what I needed to do and it doesn't work for them. Like, for example, prime example, I never dated and people thought that was weird. You should date a lot of people, but then I'm looking at the person telling me, and that way of finding a mate has been very disastrous for them. So if history is best qualified to reward our research as taught by the most honorable Elijah Muhammad, why would I do something that's not working for you? As if that is the evidence that it's working for me.
Right.
So, like, is the person talking to me, did they engage in a clinical trial? Why not? Why should I? Again, and these are all the things that we should be taking into account. So I have another question, bro.
Yes, sir. Matt, we just gonna keep going with that.
This is lit. So this is from at Brother Elijah X. This is a proud young brother out of the Al Kabir squad, Muhammad Mas number 12. He asks, and again, to the extent that you to answer this question, he says, who has access to the information, I'm assuming, gathered from a clinical trial once it's recorded? And can that info be bought?
Okay, so I can definitely say with HIPAA laws, there are a lot of different restrictions in that. So no, not on the clinical trial space. By law, they cannot sell your information. I don't even get your information working in a research lab. They use numbers or just kind of case numbers. So no one outside of your direct doctor's office is going to have access to your name, your birth date, and social security number. Like I said, we don't even have access to that. You are case 1, case 2, case 3, things like that. So no, so you don't have to worry about that when it comes to clinical trials. I can definitely say we have definitely with HIPAA been able to hold tight to your information and your health, and everybody and their mom can't just get a hold of it.
Right. Right. And I'm big on that. I'm big on patient privacy, and I advocate for my patients when I'm working with them, because we have a lot of and the part of this question where he asked, can it be bought? Can the information be bought? I've seen cases where institutions, or let me put it this way, people who are working for these institutions have access to the information and sell it for profit. That I have seen. And I thought, and that really goes back to what Jabril was saying about motive. Like, what is the reason for even the employee? Like, what is the reason for you wanting to work in clinical trials? Why do you want to be a scientist? Why do you want to be around patient information?
Right.
Like, why are you here? So some people have very negative and very harmful motives that can go as far as, acting like they're you to cash out on an insurance policy.
Come on.
Right.
So it's very, it's insane. The medical industry has so many different so much criminal activity, and there's so much potential for criminal activity. It's not even funny because of the access to information. So it's important that we protect it as much as you can. And whatever you're doing as a patient, do your best to be as healthy as possible, so that the healthcare system doesn't have so much on you.
Right. I mean, you're right. And you're always gonna, unfortunately, like, there's so many laws in place, but you can always unfortunately get through like loopholes, like you said, someone working there. I mean, it's just kind of like working at a bank. I mean, no one's supposed to really have, obviously not supposed to have your information, but you have people that go into other people's bank accounts all the time and look at their stuff, and they're because they
Right.
have access and they're working and they're at the bank and they're not supposed to.
Yeah,
So
for sure.
it's definitely like it could definitely be an issue for sure. But directly know that like if you are going for a clinical trial and giving your doctor the information, they are not allowed to sell it. I should say that. I can't say that they won't. They're
Got
not
it.
allowed to sell it by law.
Right. By law. Absolutely. And Sister Rihanna, let me ask you something real quick. Are you willing to come back and do a part two?
Yeah, no, I definitely would. I definitely would.
Okay, because we have a lot of questions from Instagram alone, and I know we're not gonna be able to get into all of them.
Yeah.
So we're gonna ask one more question, then we're gonna do some closing things for the show, and
Okay.
then we'll get your final remarks. Is that okay?
Okay.
Awesome. Jabril, you have one more question from the audience, or do you have anything you want to add real quick?
And I actually have a question I think the audience will really benefit from. It's not one of
Yes.
the Instagram questions, but I want to
Okay.
paint a scenario. So, Sister Rihanna, one of the things that we do as a company, Original Man Scientific, we strive to deliver the advantages of research and development to our community. And Brother Tariq heads a lot of our projects as it pertains to delivering nutraceuticals to our community. So if we were to, hypothetically speaking, if we were to bring you an opportunity to engage in clinical trials for a product we were coming out with, what are the top 3 to 5 questions you would ask us after then being comfortable to engage that said trial?
I like that.
Okay. So you're asking, so if you were to bring a clinical trial to me,
Right,
what would,
based around trying a health-based product. Let's just
okay.
say a health-based product. And we at Sister Rihanna, we love for you to engage in some preliminary clinical trials for a product that we have. We feel it's safe, that's then the third. And we'd love for you to try this out in this program. What would be the top 3 to 5 questions you'd ask us to ensure your safety and to make you feel comfortable enough to engage said trials?
I would definitely ask, one, the benefit. 2, I would ask the risk. And I ask that because there's always some risk.
Right.
So if anyone's like, no, it's no risk, that doesn't make sense. So I would also ask the risk. I would ask for the ingredients of whatever the product is. And so I would look at what the ingredients was and thoroughly read through it. If I had any questions about what certain things were and why certain things were in it, I would definitely ask.
Yes, ma'am.
Goodness. The long-term effects. I would definitely ask if there are any proven long-term effects. I would also ask what makes your product different from what's already on the market. That's a really big one, I think, that a lot of people should always ask, because sometimes a clinical trial could be putting out a medication and it's like, oh, well, for headaches. Well, Tylenol does that. I mean, we know what we're getting into in Tylenol. So what makes your product different?
Right.
And because you obviously just don't want to be the guinea pig for a medication that's just going to make money. Because, you can always put out a new headache medication and people will try it and it'll make money, but you shouldn't be the guinea pig behind that when it's no benefit to you, because you already have something. It's other things out there for it. So I would definitely ask that question. And then, like I said, if there's any long-term effects that they know of. If you are female, I would ask certain questions based around being pregnant or not wanting to be, get pregnant, things like that, especially if it's an injection. It's a little different, if it's a cream that's on your skin. Because if it's a cream that's kind of on your skin, your ability to see if something's happening or your reaction is usually a little faster than if it's something that's injected into you. So that would definitely be something to think about, something that you're taking in versus something that you're just putting on.
Okay.
And then I also, ask the ramifications. Anytime you're getting into a clinical trial, just kind of, ask, what if you want to leave? Things like that. Just make sure there are no extra ramifications if you decide that you don't want to do this anymore.
Or what are you liable for if you
Right,
leave? Or are you
exactly.
liable for
Yeah.
anything? Oh,
If
you
you
owe
decide,
me X amount of
yeah,
dollars because you didn't go 6 months. You went 2.5.
right,
Right.
exactly.
Right.
And
Okay.
ask how long they think it'll be. Because it affects your life, especially if you have to go somewhere once a week. You have to go into an office or they have to come to your house, whatever it's for. That definitely affects how long it's going to be. You never want to like waste your own time as well. So like
Right.
if you don't think that you have the time and effort to put into it, you don't want to start something and not finish it, and then there was no benefit whatsoever anyway, and you've already kind of put yourself out there. So I would definitely ask that question. And ask if the medicine has ever been on the market before for any other capacity, because that really can help you with your research on, because sometimes medicines, they rename things, like they kind of like switch it up, like, oh
Yep.
no, this is like the new thing, so ask,
Right.
has this ever been on the market for any reason, and if it was, why was it taken off, what was it used for, is it safe in children, all those different things I would definitely ask. And if it's, certain things are not safe for certain ages, like you just want to know all those questions before you get into it. But basically also for yourself, just ask yourself, like, is this a necessity? Like, is this necessary? Because doctors can make you feel like something's necessary, but it's not always.
Right.
Absolutely.
Well, Jabril, you asked for 5, she gave you 15. So no,
And
don't
this is
apologize.
why. No, this
We
is
wanted
why
that.
I asked this question, Queen, because
Right.
I asked this for a particular reason. Because to me, this forms the foundation and basis of this entire conversation. So I pray everyone not only watched and listened, but comes back and rewatches this, because this is what you should do, and more. Right? My mother and father growing up have always been really big on their sons being strong self advocates. But I can only advocate for myself to the extent that I know and understand who I am and what I'm getting myself into. If I have no
Right.
requisite knowledge base and understanding, that I'm going to be walked all over. Right? But now if I come into a situation, good, bad, or indifferent, I could be dealing with a friend, I could be dealing with foe. But see, I don't know if I don't know the questions to ask. And a friend could become a foe by accident because I didn't ask the right question.
Right. You know what, bro? We ain't cool no more. You screwed up. So like,
But see,
we good.
That's what I'm saying. But that's
Right.
a real thing. So thank you, sis, so much for what you shared. On that note, family, this is the STEM Files. Tariq Cardiac, the brilliant engineer. We are live every Thursday, 8 p.m. on Facebook and YouTube at the STEM Files. Follow us at the STEM Files on Instagram and Twitter. Also at Tariq Cardiac, at Brilliant_engineer on Instagram. Make sure you share this content. You like this content, you comment, share with your colleagues, friends, family. We do our best to not only highlight the best and brightest in STEM, but give you very valuable content that is practical, that you can use and talk about in your daily lives. One of the things that I talk to Brother Tariq about constantly is, we're not the type of brothers that like to talk over people. I don't want you to look at me and be like, oh my God, he speaks well. So what? If you didn't understand anything I said, how well did I actually speak?
Come on.
Like, okay, you sound good, but it's like, did you understand what I said? So I'm about you understanding what I said. So even if you disagree, you understood, and we have what's called dialogue. So I pray that everybody enjoyed today, and thank you so much, Queen, for taking the time out your busy schedule. Again, we really value, those who come on our platform. We value their time, their expertise, and we take as much out of the show as our audience members. So, Tariq.
For sure. Yeah. I echo my brother. We definitely appreciate your time. I've been trying to get you on the show for a minute. I've been procrastinating on my end, being like, I'm gonna reach out. But I never reached out. So everything is in Allah's time. So I definitely appreciate you coming through. Richmond Zone right here, Muhammad's Mosque number 24, Richmond, Virginia. So at the end of every show, we like to do what's called a speed round. So speed round is pretty much a lightning round of questions, random questions that we do to get to know our guests. Is that something you'd be willing to do?
Yeah, that works.
Okay. Awesome. Let's get the questions, bro.
I got him. Yes, sir.
All right.
I made sure I made them more conducive to get to. So,
of course.
All right. Are you ready, Queen?
Yeah.
All right. Praise be to Allah. So, here we go. The first thing you do or think of when you wake up.
What time is it? Because I'm always nervous when I'm going to sleep.
Okay, like in the
like
morning,
that.
Like you wish what time is it? I got you.
What time is it? Like I always wake up and like, oh my God, what time is it?
Yeah. All right, here we go. Ooh, that was
man.
the funniest one.
Yeah, it's real. Like,
all right, hot or cold?
Hot.
All right, walking or jogging?
Walking.
Professional work or volunteer work?
Volunteer work.
Favorite pair of shoes of all time?
Oh, all time. Wow.
Or currently.
Or currently, yeah. I have these Nike Tenacious. These New Balances they're so comfortable. Oh my goodness.
There you go.
They're so comfortable.
New Balance got the formula. They got the formula.
Oh,
all right,
sure.
Here we go. iPhone or Android?
Oh, iPhone.
There we go. Well, it has spoken. Next question.
Absolutely.
Of course. Next question, right?
Favorite thing to cook?
Oh goodness. To be honest with you, anything that I don't have to cook. So. But if I was to say favorite thing to cook, it would probably be just a piece of salmon, because it doesn't take long to thaw out salmon and it takes 2 seconds to cook it in the air fryer.
Got you.
Depending on who you ask, air fryers are bang. Like
they are.
Like,
they are.
Everybody need them. All the aunties are talking about their air fryers. That's right. All right. Favorite song of all time?
Oh goodness, favorite song of all time. I would say Anita Baker, "Give Me the Best That I Got."
Wow. Okay, you went old school with it.
I took it back. I took it back. Anita was amazing.
Nice.
All right. Youth engagement or raising funds for your nonprofit?
Youth engagement.
All right. Worst job you've ever had?
Oh God.
Don't hold back on that one.
U-Crops. Oh my God. I used to work at U-Crops when I was in high school.
Wow.
And
back
it was
when it was
so bad.
Martin's, right?
Yeah, now it's Martin's. I used to hate that because you have to take people's groceries out, and I would be like, wait, what? Are we still doing that? In this day and age, you still got people taking your groceries out. If you don't take your own groceries out, I hated it.
Got cards for a reason, right?
Yeah. Exactly.
Oh man.
All right.
Got you.
If you were stuck on an island for a year, you can only listen to 3 albums. What would they be?
Oh wow. Okay, 3 albums. I would say J. Cole.
Yes. Okay.
Have to J. Cole.
Got to.
Goodness. I would also say, I don't know. I'm really into Burna Boy right now.
Who's not?
You're the second person that said that. Yeah.
I know.
Who's not? Like,
I really am. Everyone is into him, and I'm not usually someone who's into something that everyone is into, but he's really, really good. And then for a female, I would definitely say, goodness. If I do old school, I say Toni Braxton. Like, she's like one of my favorites.
Yeah, me and Sis gonna be on the island chilling because I'm vibing with this. She said Cold World, Burna Boy, and we about to be
you got a little bit of everything.
That's some good music right
rocking.
For sure.
Okay, that's tough. Okay, if you could meet any scientist from the past or today, who would it be and why?
Oh, goodness. God, y'all have some stumpers there.
And they don't have to be like from the past. They can be just anybody that you can think of in science that you know for sure has influenced you.
Yeah. Oh, wow, that's a lot. It's definitely a lot. You know, honestly, I would say I have a professor that was at VCU, Dr. Fisher. She was like amazing. So she was just such a great scientist, and so she's published a few times. And I just really, really liked her just because I felt like she was someone who could see, like she was someone who could teach science in so many different ways. It wasn't just cut and dry, like teaching it out of the book. And so when she could see that students weren't necessarily like catching on to something, she would find another way to relay it to you. And I really liked that because a lot of teachers never really took the time to do that. And even though she was a professor, she also had her own research lab and she was doing her own research, which I helped on a few times. And I just really loved the fact that she said, and I think it was because she talked about how one of her, she had a child with a learning disability. So she's like, she had to figure out how to teach her own child differently. And so being in college and when you're at VCU, it's such a big school and it's so many different students, you don't really get one-on-one attention. And so to have just someone who cared enough to see like, if you weren't necessarily understanding something, she would be like, okay, well, let me figure out how to switch it and how to like get you to grasp it. And to me, that's super important because I think that a lot of times in math and science, if a student doesn't catch on right away, they feel like they're not good at it. And then they decide to leave. Like they decide not to pursue it or go further into it because, oh, it's too hard. And so I think it's really important to have teachers that are able to teach our students in different ways so they can be interested in those subjects and, you know, feel comfortable and not just because they didn't get it the first time or just get it the way that everyone else is getting it through just reading a book.
Got it.
Excellent,
Nice.
excellent. Now, see, she don't count because you met her.
I know.
You know,
That is true. That is so true. You did say it had to be someone I didn't meet.
No, it's okay.
But that's good.
It's
I
good,
appreciate the
yeah,
story.
I wanted to hear that.
Dude,
yeah, that was
I
good.
did.
That was good to know.
So, last two questions. So, if you weren't a senior proposal manager, what would you be?
I would own my own fashion line and live in New York. Yeah.
Okay.
Yeah.
I feel it. I feel it.
Totally
It's
left
just too
field.
many people. It's
Totally.
just too many people in New York for me. It's just too crowded. It's
I
just
love
too
it.
crowded, but I feel it. I feel it. Okay, here
Yes.
we go.
Wait, what part of New York? Like, would you live downtown Manhattan or?
I would live in Soho.
Oh, okay. Okay.
Yeah, very
Bet.
specifically Soho.
Bet. Okay. Awesome. Obviously, I'm from New York, so like, you know, as much as Jabril likes to take that from me,
I don't.
you know,
try
I'm
that
definitely.
anymore. You're so sensitive. You're just so sensitive.
I am like you know better now. You know better now. But for sure, like, you know, I'm an uptown Manhattan guy, so you know, Bronx, those Manhattan and Bronx, like if I could settle there, I definitely would. But the people thing, like I went back last year and forgot just how many people are actually in Manhattan alone, and I was like, God damn, like where all these people come from? I was sweating just driving down in downtown Times Square. I was like, yo, if somebody jump out in front of my car one more time, you know.
Yeah.
So
you
it's
can't
a
have
lot,
anxiety and walk through New York. Like if you have any anxiety issues, New York is not the place.
You see, that's the thing. I've been down
all around.
I've been down south too long. That's what the problem is. Like I stayed down here too long. It's like a fish out of water. Like all right. Yeah, for sure. But family, this has been another edition of the STEM. Oh, go ahead, bro. My bad.
No, it's the last one. It's the most important one. All right, so here we go. So listen closely. My name is Sister Reana Muhammad, and I am.
And I'm supposed to finish it?
Yes. Yes, ma'am.
Okay, and I am an open book, sarcastic, and a great friend.
Awesome. Praise be to Allah. And how can the audience contact you?
Oh yeah, thank you. My email. Just shoot me an email. That's the best way.
Okay. Awesome, family. Right there at the bottom, Reana.Muhammad@gmail.com. I'm gonna leave it up there for a few while we close out. But family, once again, this has been another edition of the STEM Files, where we are the voice of STEM talent and Black culture. We give you the best, the brightest in science, tech, engineering, and mathematics in the Black and brown communities. I am Tariq Cardiac. co-host right hand, Jabrilian engineer. We just interviewed a powerful guest right here out of Richmond, Sister Reana Muhammad, senior proposals manager in clinical trials. And I just want to say, once again, thank you again for joining us on our platform. This is your platform. As Jabril always says, this is your platform. Whenever you want to grace us with your presence, whenever it's something big happens in your life, especially as it relates to your career, this is the place to tell the world, to tell your community. I know Richmond is on deck watching, Philly's on deck watching. Most of the East Coast is watching us right now. So I think a lot, right? I think a lot for our audience as well. And for those who are watching and would like to know who next week's guest is, it's gonna be I don't know. I mean, did he tell you he was coming on the show? Did Amin tell you he was coming on the show next week?
What? No, he didn't.
Yeah, I thought I told you that.
No,
I didn't say that.
But you should have just kept it a surprise. That would have been tough.
Yeah, I should have. But Amin, who is Jabril's younger brother, just graduated from Howard University with a degree in
mechanical engineering.
Right. Mechanical engineering. He's on his way to pursuing his PhD in nanotechnology.
His master's in nanotechnology at the University of Pennsylvania.
Masters. Okay, awesome. So he's going to be on the STEM Files to settle. My bad. He's going to be on the STEM Files to celebrate his journey so far. He was on the STEM Files last time when we were interviewing our younger siblings who are also in STEM. Yes. And he's gonna he was on here twice by himself and with my sister. Mm-hmm. So he's gonna be back for a third time talking about what his career outlook is looking like right now, his journey in Howard, and the super engineer that he's about to become. So definitely stay tuned. Right,
exactly. Out this month.
Definitely. So stay tapped in, family. Tune in next Thursday at 8 p.m. Eastern Time, May 26th, to talk about our brother. He's phenomenal, incredibly smart, and he's about to get married. So we're going to be talking about that too. Yes. All right, cool. So, family, thank you for tuning in. This has been another edition of the STEM Files. Peace.
Peace, family.